are back, ladies and gentlemen, on the fastest podcast on the airwaves today, the Cat's Corner podcast, with your host, the three-time world karate champion, WWE legend, WCW legend, Academy Award nominated film actor, and one of my dearest friends, Mr. Ernest the Cat Miller. He's your host. I am your co-host, Ray Big Shug Keziah. On this microphone, we spit fire. Before we get started on our great show today, how about a word from our illustrious sponsor, Recite?
We're Recite. Of course we offer all-inclusive site work. We're Recite. Of course we have a dynamic site crew. We're Recite. We have secure foundations. We're Recite. Of course we're good stewards. Recite redefines the way site work is done. Contact us at recite.com. It's re-site.com.
We couldn't do it without Recite. Thank you. Thank you, Recite. Also, don't forget to hit the like and subscribe and the share button. And also, if you're feeling froggy, let's go to Cash App, the $, Cat's Corner podcast, and send us a little jingle, little jangle, little, we like the jingle jangle, but we kind of like the ones that fold too,
Hey, listen, just send something. You buy a cup of coffee and you watch you look at the trees and the birds. Here you get the same entertainment, but you get even better. Big Ray, Let me ask you something. I'm getting ready for WrestleMania. I'm getting ready to go out to Vegas, baby. This is the biggest show in the world. This is the Super Bowl of pro wrestling.
It dang sure is.
So
I'm still trying to figure out if I'm flying out or not. Trying to figure it out.
Listen, we're going to be backstage. We're going to do interviews. I got about 3 or 4 interviews set up with big names. I'm not going to call them out right now, but we got some big name people coming on just to say hello to the Cat's Corner and all the Cats fans. So listen, bro, I'm looking forward to it. And I talked to one of my friends. Yesterday, man. I don't want to call his name, but this guy right here, man, was like an incredible athlete, man. Incredible athlete. You may know who he is, Ray, and I'll tell you off the camera, because what we talked about today, man, was, I don't know if it's CTE, ADHD, or whatever it is, but it's something. He said it just make him feel sad all the time.
He's got a little bit of depression. He's dealing with some depression.
Yeah, and this guy right here had it all. He made money. He big name, a superstar in the wrestling business. Made a couple of commercials and movies, and it kind of scared me a little bit, man, because the brain, man, is like, to me, when you hear people talk about the brain, they got so much stuff out there. But what worked, I mean, listen, if you ain't bleeding out the ear, that's what we're saying. If your blood ain't coming out your ears, you all right.
Rub some dirt on it and get back in the game.
Yeah, get back in there. If you take a headbutt and you get a little dizzy or something happen like that, what do? When do you go see someone? Do you wait until you explode?
Well, in the sport we love the most and we talk about the most, professional wrestling, Chris Nowinski, Nowinski or whatever his name is, he started a program for head trauma and whatnot, and it's nothing to mess with. It's real.
But see, I don't know. I think they allow Chris to come in and check. And I'm not talking about no particular sanction. I'm not talking about WWE or AEW. I'm talking about friends. Guys, I know. Chris Benoit was one of my friends.
Right.
He was one of my good, dear friends. And look what he went through. And the only thing they came up with is he went crazy and killed his
brain of a 90-year-old man, they said.
Yeah, but when did that start? So
anyway, you remember his finishing move? His finishing move was the headbutt off the top rope.
And he was doing that how many times a year? Oh, and he was doing it down there every night. So he's giving himself concussions over and over and over and over. Not one time did he ever complain.
Nope.
But I got a guy coming on today, man, and I don't know what he know about the brain, but I know he's a surgeon. I know he know how to get inside. I know he's been inside the head, closer to the brain than we have been.
Well, maybe he'll figure out between the both of us if we have one or not.
Well, that's not me. That's not me to figure out. This guy right here know how to cut it up. He cut it up like a potato. So I'm gonna find out. I'm gonna talk to him about this, man, and I'm gonna be open about it. Got some questions from some fans that I told he was gonna be on. And I want to start digging into this brain stuff. So listen, man, without having this guy, man, bring on Dr. Jerry Walter.
Dr. Jerry Walters.
Hey, Doc.
Welcome.
Hello. Good evening.
How you doing, Doc?
I'm doing great. How are you?
I'm doing good. So, Doc, tell me about your career. I know, but the people you look like a kid, so they're gonna think you're a kid. But tell the people how long you been a doctor and what was your steps and where are
Doogie
you?
Howser.
Oh my God. So to both of you, first of all, thanks for having me on. Kat, it's been a long time coming. We kind of discussed this opportunity, so finally we could kind of meet from a scheduling standpoint. So happy to share this time with you both. So I'm Jerry Walters. I'm a neurosurgeon here based in Atlanta, Georgia. I'm originally from Jackson, Mississippi. I attended Tougaloo College, which is a historically Black college in Mississippi. I went to medical school in Rhode Island at Brown University. I then did neurosurgery residency at the University of Arkansas for medical sciences. That's in Little Rock. And finally, I finished there in 2020. And I have been here based in Atlanta practicing neurosurgery for almost 5 years. Our practice is Legacy Brain and Spine. And we have kind of satellite centers, 9 of which kind of surround the perimeter of the greater Atlanta area. So as a neurosurgeon, I treat a myriad of conditions, mostly involving the brain and spine. So certainly happy to get into concussion and head injuries with you gentlemen tonight.
Well, Doc, I'm gonna get right in there. How can you tell when the brain needs some work? I mean, like you, Doc, I know you're a surgeon. I know you open it up and you dig in. Well, how do you know a brain needs some work? It's a bad brain, a damaged brain. How do you know that? What are some of the symptoms?
Yeah, so I think if we're talking in terms of someone who we suspect has either recently or previously experienced concussion symptoms, then there's a very wide range of symptoms. Everything from the classic chronic headaches to changes in personality, people being more irritable, more easily frustrated, more prone to anger and aggression, problems maintaining sleep, problems getting to sleep and waking up, problems with energy, problems with processing information, problems with memory, problems with balance, problems with coordination. I mean, these symptoms really are as long as we want to take them. And it's so broad and so far reaching that most people that have been impacted by concussions often don't know. The reality is that we're fortunate enough now to be in a day and time where there's greater awareness, but it certainly has not come without cost. And so as far as we've come, we still have a lot more that we need to understand in terms of concussion, particularly in our in the sporting arenas, both in combat sports and wrestling. And so happy to dig into it.
Well, speaking of digging into it, right? When do a brain, and that's what I'm saying, when you get the person, they probably already been through a lot of stuff, and they come into you and say, Doc, we need you to have surgery right now on this brain. What do you do when it comes to surgery? What do you do?
So it depends. From a brain surgery standpoint, most of what I do is typically traumatic. And so I collaborate with a lot of the hospitals in the greater Atlanta area. And a lot of our patients come in after simple ground level falls, particularly something that we see quite commonly in our elderly population that may trip and fall and unfortunately sustain brain hemorrhages. They're, I would say, a few kinds. There's brain hemorrhages that happen outside of the brain, meaning epidural or subdural hematomas. There are and intraparenchymal hemorrhages, which actually occur in the substance of the brain. Depending on the size, depending on how patients present, how severe the compression is, they may in fact require evacuation of those clots. And we do a lot of those in the traumatic setting, emergently, to save life and more so the quality of life. So that would be kind of the trauma side. Of course, in neurosurgery, we also treat patients with tumors and different space-occupying lesions of the brain that may require resection. There's another subset of neurosurgery called functional neurosurgery, where we place various electrodes and implants to modulate the way the brain behaves, mainly in patients with Parkinson's disease and essential tremors as well. And then finally, cranial-based surgery is also still very effective in treating cerebral vascular disease, namely intracranial vascular malformations like aneurysms and arteriovenous malformation. So again, neurosurgery is such an all consuming specialty, and that's just really, I think, the tip of the iceberg. We do a lot of stuff in the spine as well, and so.
Where can damage start in the spine, like, and then move to the brain, or does it start in the brain and move down the spine?
It's kind of interesting. It depends on. Mostly, we don't necessarily think of the two being related in that way. But I will say for a lot of our patients, not just athletes, but people that have very physically demanding jobs, the same processes that would relate to spine injuries, like someone falling off a ladder or having a remote accident years ago, people that have been in multiple car crashes, those same processes can obviously negatively impact the spine. They can cause degenerative disc disease. They can cause nerve compression. They can cause intractable pain. It can cause fractures. They can also lead to chronic pain. But that subset of patients that have experienced a lot of trauma also may have had prior concussions that went undiagnosed. They may have had small brain hemorrhages that also went misdiagnosed. And so it's not uncommon for us to see the patient that's older with chronic spine issues, but also have brain pathology as well.
Wow.
That's so interesting, because especially when you're talking about the elderly and stuff like that. Now, when we're basing it on what we were thinking about, it's more from the athletic side. Like, I wrestled in high school, played football and stuff. So, and then I've hit my head a couple of times. So I know I've had a couple of concussions, and I have a little bit of brain fog sometimes. I'm not sure if that's one of the symptoms. Is brain fog one of them? Kind of where you know this guy's name, but it takes you a minute, and then it hits you. Okay, that's Fred, or that's Johnny, but you don't know it right offhand. You know the name though, and
Absolutely.
That's a little concerning. I'm 54 years old, so that kind of concerns me a little bit.
I mean, I think with what we consider normal aging, there's certainly little room for challenges with maybe some short-term recall, particularly things like names, like you discussed. But I mean, certainly for anyone that really suspects or is concerned about their level of brain function, we certainly always recommend further testing. There are a lot of tests that can be performed by either neurologists or neurosurgeons that can quantitatively assess the function of the brain and come up with certain recommendations to try to optimize that as much as possible.
Are there any exercises for the brain that you recommend for somebody that, like,
so I think
memory cards or flashcards?
Absolutely. So I think there's a lot of data that supports in terms of brain health, the general idea that, you either, use it or lose it. And so it's so funny. So my grandmother lived until she was around 95, and she had a lot of physical limitations, but from a mental and cognitive standpoint, she remained sharp up until her last days. And it's so funny, growing up, we would always pick up these crossword puzzles for her. And every time you saw her, she had a crossword puzzle in her hand. And so there's a lot of data to support things like that, whether it's memory cards, whether it's crossword puzzles, whether it's reading, whether it's doing research. Karate from a physical standpoint, aerobic exercise and maintaining physical, mental, and emotional health certainly is very good for the brain as well. Having even data that supports having a support system, which martial arts doesn't get enough credit for, the community that martial arts really cultivates. So the supporting structures are really making sure you have a community, making sure you have friends and reliable people to support you, maintaining a certain level of physical fitness, and then obviously challenging your brain as much as possible, as regularly as possible, to make sure you're continuing to grow.
Now, when you said challenge your brain, do you think you can reverse brain damage? Can you reverse it without surgery?
Yeah, so very rarely would we ever perform any surgery for someone with what we diagnose with general brain damage, because unfortunately, these changes happen at the cellular level. And so we often, they're so widespread and diffuse that even on standard imaging studies, you can't really see it. And so it's almost like the overview effect. When you zoom out and you're looking at the Earth from an astronaut's perspective, it always looks the same, regardless of what storms are going on or what's going on in you and our day-to-day lives. But we know that deep down at that cellular level, there's been significant changes. There's been damage. There's been loss of cells, what we call cell death. There's neurons, both the cells and the circuits have been disrupted. And so unfortunately, to date, there's no real role for surgery for people with kind of chronic brain damage due to repeat concussions. But what we do talk in terms of trying to slow the progression, meaning optimizing all those parameters we just talked about, like making sure you get plenty of nutrition, namely your B vitamins, your vitamin D, your folate, so leafy green vegetables, fish oil, all these supplements.
Whoa, wait a minute, dog. Don't give all the secrets away, because if you tell people how to fix it organically, they may not need to come to you, dog. That means you won't be doing any surgery, right?
It's not a self-serving recommendation, that's for sure.
Well, his first oath is do no harm, Cat. So he's trying to do no harm.
Exactly. I will say that before I got on, that was an interesting way you described it. I think you said cutting it up like a potato, and I don't want any of my patients to think any potato cutting is going on.
Okay,
watch the Cat. He will run some business off.
Hey, doc, I'm a pro wrestler. I'm not a doctor. Let me ask you this, doc. Let me ask you this. What about activity in the brain? Low activity and high activity. What is better? Which one is better? For it to be low activity or high activity?
I think it depends on what you're doing.
I mean, when you're looking at a scan, let's just say you're looking at a scan.
Most of the scans that we take for the brain are static, which means that they're taken in a very short period of time. And when you're looking at the scan, there's no motion. Now, you can get different functional MRI studies. You can get things where you can specifically assess certain areas of the brain. For instance, when someone is talking or trying to recall something. So that's kind of a subset of neuroimaging. But for most scans that we get, they're static, which means they're taken in a very short period of time, and there's no movement. And so in terms of grading high activity, low activity, it really depends on the region. I would say in certain areas of the brain, like the limbic system, high activity is associated with certain, chronic conditions like mental health disorders, versus if we're talking about in the frontal area, low activity is also associated with certain mental health challenges. And so it really depends on the area that you're looking at. But I would say 99% of the scans that I see every day are just taken in a very short period of time. But it does represent kind of an assessment of present and past, which means that we can often see insults that happened years ago. We may see an area of damage or contusion or what we call atrophy that can happen when someone suffers from a traumatic brain injury. There's always signs that we can tell even long after the fact, where we can say, well, yeah, that area certainly was impacted, whether it was a stroke, whether it was a bad head injury, or et cetera.
I've heard, Doc, that some diseases can start, let's say, 30 years ago, and it don't show don't show anything until it just show up. But it start to kind of compile and damage the brain,
Yep.
and like CTE. I
Mhm.
mean, when do that begin? You can't tell.
It's so interesting. So it's just similar to how I described that overview effect. Is that our imaging studies are still quite, I would say, rudimentary and really allowing us to visualize damage to the brain at the cellular level. Like I said, even in the midst of a concussion by definition is a mild traumatic brain injury with a normal scan. And
Wow.
so what's happened is that in some from some sources and some organizations will actually say that concussions exist and there's no structural injury, but we now know that's not the case. When you have a concussion, there is a structural injury to the brain. It's just it's not manifested significantly enough for our images to really see it. And so
No.
brain damage can occur way before we can see it on the scan. And so, which is why in this all this research and all the resources have been really pumped to really trying to greater understand concussion, not only how we can prevent it, but how we can protect the athletes from themselves. Because obviously there's been historically this burden to get back on the field, get back in the ring, not interrupt the show, which unfortunately has probably resulted in more concussions before the brain has had an opportunity to recover. That's what we call second impact syndrome. And that's a major factor that can lead to CTE or chronic traumatic encephalopathy.
Wow.
So the first concussion, and then the second one's easier to get because you've already had one. And the brain has a memory, so it goes directly back, and that's why you have multiple concussions. The first one, that's what always concerned me about Tua, the quarterback with Miami. It didn't look like a bad fall, but he's had so many concussions that even the slightest fall could trigger another concussion.
And the reality is that all of us have different tolerances to head injury. And so I think you're talking about Tua Tagovailoa, who very clearly even falls that we may not deem significant, and looking at it from a spectator standpoint, we may think that's a mild fall, but it's the same thing I see with people that have been in accidents. There's some people that can be in accidents where you're amazed that they even walked out and they won't register one single symptom of a concussion, versus others may just be bumped in the rear end of their vehicle, may have a flexion, kind of a whiplash mechanism where their neck is thrown forward, may not even hit their head directly, but they can have concussion for weeks. And so there's just a very wide variability in terms of each individual's tolerance to brain trauma or head contact or head injury. And also that also lends itself to saying some people recover a lot faster. But what's important is that before you get back on the field, before you get back in the ring, before you get back on the court, you have to be symptom free. And I think that's the main take home message here.
But as you move through life, even with before and after a concussion, you still have to, how can you tell when a person is going through something? Let's say because he depressed. He depressed. I got a bunch of little karate guys, little nephews who they took a small fall or something, might have taken a small fall back in the early years and got a little concussion, and people thought, he's okay. It just he bumped his head. But then he started acting a little, I don't want to say the word crazy, but they start complaining of headaches. They start the decisions that a person will make in their right mind. It seems like they always go the opposite. And some people look and say, you know what, that could have been from that concussion. It could be the part of the brain that's not working.
That's very true. And then retrospectively, there's no real way to determine that. I think based on someone's past experiences, we can certainly theorize, we can surmise, but on the other hand, there are people that suffer from concussion. There are people that have issues with their cognitive ability for reasons that don't include traumatic injuries. And so looking at it retrospectively, it's almost impossible to say. But what we can, which is why CTE, even in itself, can't be diagnosed until you can, look at a brain on a microscopic side after someone has unfortunately died.
Yeah.
And so, and so that's really the challenge. I would say that if you have any concerns about your cognitive well-being, both from memory processing, speech, to your mood, regulating your mood, being more prone to anger or irritable, the simple answer is to contact your primary care doctor, try to get a referral to a neurologist to get further testing.
But when do like a psychologist or psychiatrist, when should you bring those people into like working with you?
So psychiatrists, they treat obviously various mental and neurocognitive or neuropsych issues related to the brain. We always think of psychiatrists as obviously they're the first line when it comes to really treating and understanding issues like depression, anxiety, even the more other conditions like bipolar disorder, schizophrenia, psychotic episodes, and all those, they have multiple subsets as well. But psychiatrists are most kind of equipped to deal with those. They also manage delirium, which are acute states of confusion that are mostly activated by some specific stimuli. And then neuropsychologists, to take it a step further in the concussion world, they're very instrumental in what we call neuropsych testing. And so there are a lot of validated tools that they have, both digital and on paper, that are intended to dive a little deeper in the severity of a concussion to really tease out what symptoms are manifesting. If we're talking about memory loss, how bad is it? If we're talking about problems processing, how bad is it? Is it mild? Is it moderate? Is it severe? And from there, they can often refer you to a treating physician that's trained to treat various injuries of the brain to either get you on medication or prescribe you other recommendations that will hopefully help you recover.
Wow, Doc. I mean, you've shined a lot of light on this issue. Just it needs short 28 minutes. And I want people to know about you, Doc. How old are you, Doc? You look like you're about 38 years old.
Come on, man. Don't do that, man.
Oh, man, you're a kid. And what brought you to this point? When did you know you want to be a brain doctor, a brain surgeon?
So I'm 37. I am not I've always wanted to do this since a child. Background story. Like I said, I grew up in Mississippi. I grew up in I grew up in Jackson, which is the capital. Never really gave much thought about medicine or anything related. I just knew I wasn't a good enough athlete, so I couldn't play sports. I went to college and had a great experience at Tougaloo College. I had some professors and faculty members that really took an interest in me and believed in me, encouraged me to apply to medical school. I was fortunate enough to be accepted to Brown University. They actually had a special early identification program, so I was fortunate enough to be accepted as a sophomore. I got to Brown and again, had a lot of people that supported me. I think ultimately when I decided to do medicine, I always knew I wanted to do surgery just because looking at all the television shows, the surgeons always seem to be the coolest in my eyes. And so,
Doc, wait a minute, you ain't that cool now.
Hey man, don't do that, man. Hey,
You're pretty cool, Doc. You're pretty cool, man.
Can I have a moment to tell my story, please?
All right.
But yeah, so I always wanted to be in the operating room. I think that concept of instant gratification, the idea that we can actually directly impact the quality of someone's life with tools was something that always resonated with me. The brain, even itself, I always call the last frontier. And so everything else in medicine seemed very, I don't want to say simple, but easier to understand. If you explain the way the heart works to a layperson in general terms, most people can understand it. Same thing with the lungs. But if you take this 4 pounds of flesh that represents a human brain, and you try to explain to someone that it controls your heart rate, the rate that you breathe, your movements of your arms or legs, but it also controls your memory. It controls your sense of humor. It controls your level of anxiety. It controls your personality. You can dice it up in small sections, and you'd be just as confused after you dissected it as you were when you stared at it for the first time. And so I knew from that vantage point, I could dedicate my life to it. I'd never have a boring day. And that's just the brain. We also, 80% of what I do is actually spine. And that's another very, very interesting part of the human body where we can impact people's quality of life by treating their pain. We can restore function by, decompressing nerves or stabilizing segments that are moving excessively. And so every day is an adventure. I don't wake up at any time thinking it's just going to be another run-of-the-mill day. And so that's a very exciting part of it for me.
Well, before you go, dog, I don't want to take up too much of your time because I hear you charge about $2,000 a minute.
A minute.
Hey, bro, this is on the house.
I don't want to take up your time, but I want one question. I read something about you help cure somebody's back. And they said, how in the world could a brain surgeon help cure my back? Tell me about that story.
Yeah, so I think neurosurgery in itself, we treat brain and spine conditions. Most of what I do happens to be degenerative conditions of the neck and back. So people with chronic neck pain, what we call cervicalgia or cervical radiculopathy. This typically happens due to wear and tear just over a lifetime. The spine is just like any other joint, whether we're talking about the knees or the hips. The more we move a joint, the more it will degenerate over time. And as those discs gradually lose water content, they can start to bulge, they can press on nerves, which can cause very, very severe pain. So there are a lot of surgical options that we perform every day that are very effective in relieving that pain. And we have patients that can be completely debilitated. They can be confined to a wheelchair. They can have difficulty standing up for more than 10 minutes. And very often, if we can determine what that problem is, fix it surgically or improve it surgically, then people can have a much better quality of life. We typically see these conditions in people as they get older. And so most of my patients in that subset are, 50s, 60s, 70s and above. But we also obviously treat young patients. There are a lot of patients that have these conditions in their youth. And ultimately, the name of the game is to try to help people feel better. We try to exhaust the conservative options first. So we never proceed straight to surgery. The most of my patients get through our office without ever getting, surgery, and we're really happy about that. But for the ones that do, I think we do really good work. We have a great team. We have 5 surgeons at Legacy Brain and Spine, and we also have 3 nurse practitioners and a host of other staff that are very instrumental in making sure that each person has a positive experience.
So let me ask you this, Doc, then I'm gonna let you go. Let's talk about insurance. To come to you and you tell somebody you need to have surgery on your brain, how does the insurance company work with you on that? Do they work with you? Do you like the process? Are you against the process? What would you like to see improvement?
Yeah, these are very hot, pressing topics right now. The reality is that for all of us, medical providers, and not just medical providers, but any doctor, specialist that works with insurance companies to obtain support or revenue for our work, that process is changing, and it's changing very fast. So what typically happens is that a patient comes to my office, and whether we're ordering a test or ordering a procedure or ordering a surgery, there's a pre-authorization process where we submit our documentation, we present a case to the insurance company to support whatever treatment we recommend. And I will say that the burden of approval is growing, which means that we're seeing a lot more denials. We're seeing a lot more appeals that we have to do. What this does, unfortunately, it delays the care of patients that often need care as soon as possible. But number two, it also results in a larger burden for the practice, more time spent on the phone, which unfortunately creates longer wait times, more resource allocation for those processes or taking resources away from patients. And so there's a lot of debate right now on the future of medicine. And I think that's really what underscores this mass exodus of all these people that are getting out, because not only, we have some challenges with insurance companies, but we do a lot of, I would say, paper pushing. There's a lot of burden in terms of documentation. There's just a lot. Practicing the medicine part or the surgery part is the most enjoyable. That's what we all wake up to do. But that's accounting for less and less of our time. And we think it should be the opposite. We would like to focus our time and attention on patients. But in our current healthcare system, that's unfortunately not the case.
The bureaucracy slows everything down.
I heard, Doc, and I'm going to let you go, Doc, but I heard somebody say that the insurance used to pay the doctors more for one procedure. Now that doctor got to do two of those procedures because they cut the price down on what they were giving you just to, make ends meet. And when I said make ends meet, pay your staff. Yeah. But then insurance is raising the rate of money.
Exactly.
To the consumer, yeah.
If
the patient pays more to the insurance, but the insurance doesn't pay you.
Ray, let the doctor talk.
No, you're absolutely right, Ray. I think that if we adjust for inflation, over the last 20 years, the reimbursements for doctors has actually gone down significantly, and that's in the greater context of costs going up. So obviously, every part of the process, whether it's leasing the building, whether it's paying for equipment, whether it's supporting your staff, whether it's every cost outside of what we actually provide in terms of surgery and procedures goes up. But what we're making now from a revenue standpoint to support those other additives is going significantly down. Part of it, I think, is due to this. We have a pay per performance model. And so, if you do one procedure, you get paid for one. If you get 5, you get paid for 5. And there has to be, I think that was, that what's going on now is a lot of lobbying, a lot of litigation to try to balance the playing field for those of us that, and it's so interesting because from the general public looks at doctors and everybody, will look at doctors and feel like, you make so much money. But, on the other hand, you think about someone like myself who pretty much worked the last 15 years to become a neurosurgeon. I accrued a lot of student loan debt, high interest debt that I signed at a very young age without really understanding the implications of that. I thought that 10 years ago I was going to be privy to make a certain amount of money, to have a certain quality of life, but that's changed. And so all of us are finding more innovative ways to maintain this profession, to continue to provide the best care to our patients as possible. A lot of us are leaving medicine altogether. And for the communities and areas that are in the rural communities, having access to good subspecialty care has a lot of impact on how long you're going to live. So, how long it takes you to get to the hospital if you have a heart attack, or how long it takes you to get to a hospital with a neurosurgeon if you fall and bump your head and have a brain hemorrhage, that has very, very significant consequences. And that's not getting enough attention. The more people that are leaving the profession, unfortunately, leaves the patient at the biggest risk.
With less and less options.
Exactly.
Well,
they're not going to be happy till it's all socialized. So, but hopefully we can push that off the agenda with voting.
Well, Doc, listen, Doc, we're not gonna keep you anymore, Doc. But you coming back on, baby. I'm gonna have you back. I'm gonna bring a couple of guys back that work with the brain CT, that work with the WCW, WWE crew, or some guys that need the help, we're gonna bring you back on. And I want you to talk face to face with some guys who may not believe in the same thing that you believe in.
Hey, I'd love to. Please don't hesitate to reach out.
Hey, listen,
Appreciate your time, Doctor.
Thank you.
Doc, do you want to tell them about what can people see you on social media? Yeah, we ain't talked about your, you know what? Yeah, I didn't want to throw that out there. Let people know that you got a little fight club. You got all this stuff going on.
Yeah, so you can find me on social media, Instagram, Dr. J. Walters. Easy to find. And then in terms of the fight gym, we have a gym in Sandy Springs. It's American Top Team Sandy Springs. Cat has been gracious enough to come on several occasions. The guys always like mixing it up with you, a guy with a vast reservoir of knowledge that'll still get on the mats and teach a lesson or two from what I've heard. So obviously, both of you, thank you for your support. Very grateful to spend this time with you and always happy to come back.
All right, Doc.
Thanks for coming on.
We gonna see you out of here, Doc, and thanks for coming.
Thank you, guys. Have a good evening. Thank you.